Hello and welcome to another episode of the Brain Talk podcast, where we delve into the complex subjects of neurology. I am joined with guest Noor, who is a medical student. I'm your host, Sada Sadiq, and today we will be talking about PMS and PMD.
Hello, Assalamu alaikum. My name is Noor Al-Abd. I'm going into second year medical school, inshallah, in Al-Faisal University in Riyadh. I'm currently the coordinator of IGOG, which is the interest group of obstetrics and gynecology at the university.
Since our topic is in regards to PMS and PMD, which is a menstrual issue in some women, may you give us a quick introduction on what that is?
Most women of a reproductive age experience PMS, and this stands for Premenstrual Syndrome, which usually occurs a week prior to the menstrual period, and it's categorized by symptoms of fatigue, cramping, new food cravings, sleep changes, and mood swings. However, PMD or PMDD stands for Premenstrual Dysphoric Disorder, and this is a more severe version. So you have all the symptoms I've mentioned, in addition to a bit more severe versions of the mood swings, which includes depression. And trigger warning, it also can show up with suicidal ideations, as well as ineffective coping mechanisms such as drinking, drugs, and even sometimes self-harm.
So I've noticed that PMD specifically has a lot of symptoms that is similar to symptoms like depression, anxiety, and many other mental disorders in that criteria. So how do gynecologists recognize PMD given its generic symptoms?
Yeah, so usually for people with PMD, it's kind of hard to know if it's to do with their period or not. So usually they'll go and see their family physician or the GP, and it'll be like a teenage girl coming with mood swings, depression. So before saying, oh no, this patient has anxiety or depression, it's recommended to usually track these symptoms and see whether it might be hormonal related. So to do this, a lot of girls already sometimes have apps on their phones, which is always very helpful. It tracks their period and their moods, etc. But for those that don't, the doctor might recommend diary taking for like a couple of months, so let's say 6 months, and they'll track their eating habits, their sleep habits, their moods, and their period. And to note if this is going to be PMD or just depression, you'll see a pattern whereby you have these symptoms very frequently the week before the menstrual period, and then that will indicate that they may be experiencing PMDD.
So do women with PCOS have a higher chance of receiving PMS or PMD? POS, for those of you who do not know, is polycystic ovarian syndrome, which is a condition where there are many hormonal fluctuations, especially with estrogen and testosterone. So there are many women that suffer from PCOS. So do women with PCOS have a higher chance of getting PMD or PMS?
Women with PCOS, they have very similar symptoms due to the hormonal imbalance. So it can worsen PMS. So it's not going to cause PMS, but it make the symptoms a lot more severe, which also means that they're more likely to get PMD. And this is because their hormonal fluctuation is a lot greater than the regular person. And so these change the levels of estrogen and progesterone, which can also cause these hormonal mood swings and cramping. Another reason why they might be more susceptible to PMD is because a lot of them tend to have insulin resistance. And so this insulin resistance can also impact hormonal levels. So they can have more pain, more discomfort, which will result in worse mood swings and high levels of irritability.
Which part of the brain is specifically affected by PMS or PMD?
We have the limbic system, and this is the area for emotional regulation. And during PMS, this area is greatly affected by the changes of hormones. So the main two areas I'd say of the limbic system that's affected is the amygdala and the hippocampus, because these are related to anxiety and irritability. We also have the hypothalamus, as it's responsible for hormonal regulation. So these areas are affected.
Another question would be, are there certain habits that can increase a woman's risk or likelihood of getting PMS or PMD?
Yeah, so sometimes having an unhealthy lifestyle, having lots of caffeine, high levels of salt intake in your diet, there's nothing really you can do to prevent PMS. But for PMD, if you're not genetically inclined to end up having PMD, then avoiding these diets, and also making sure that you do a lot of exercise during the month and during the week of the PMS, which is the week before the period. It's important to do lots of relaxation techniques. So things like yoga, meditation, or if you're religious, a lot of time spending working on this will greatly impact preventing worse symptoms during this week.
I think it is not emphasized enough that during the menstrual cycle of any woman, it's a mainstream narrative that women
Yeah.
usually like eat chocolate, that they eat junk food, that they're
Mm-hmm.
usually not engaging in any exercises, not taking
Exactly.
walks, not doing anything that, might help them with their period. And I think this is something that is not issued enough and should be advocated for
Yeah.
more in the media, because just because, a relative of yours has her period doesn't mean the best course of action were to get them, pieces of chocolate or get them
Yeah.
candy, because it might actually worsen their period or might give them a harder time throughout their
Yeah.
menstrual cycle. So uh, indeed like um, you have indeed said a lot of valid points in regards to
Yeah.
how can a woman uh, change her habits so that
Yeah.
her chances of getting PMS or PMD are ill. So
Of course, like during this time, it's really hard to help with the cravings of like chocolate and sweets and stuff. So it's okay to have it the one off, but binge eating it this entire week is not going to do any benefit for you.
yes, and this is, even though this is very important to know, it might be a bit difficult, especially if a woman is going through the menstrual cycle. It's definitely hard to resist the urges of binge eating or eating,
Yeah.
junk food and whatever.
Hmm.
So that is a very valid point to make. So, can PMS or PMD be linked to any neurological imbalances in a woman?
In PMS or PMD, we have a decrease in serotonin. This could be due to the changes of estrogen. And also estrogen can, because of the fluctuations, it can result in a decrease of dopamine as well, which this
Mhm.
is why we have mood swings and changes in appetite and changes in sleep.
Mhm.
We also have a change in the GABA sensitivity receptors. So due to
Mhm.
the fluctuations of progesterone, these receptors, they kind of go all over the place, and then that's why people get anxiety and irritability.
Mhm.
We also have the stress response system in the hypothalamus. So the hypothalamic pituitary adrenal axis, this is a lot more reactive. So this can result in higher levels of anxiety. There's some studies that suggest, it's not confirmed yet, there still needs a lot more research, but it says that the brain becomes inflamed during this time. So that means we produce levels of cytokines higher than usual, which um, these will affect the way the neurotransmitters work in regards to mood changes and increased pain perception.
I see. You've mentioned how due to the lack of certain hormones being secreted, or how or certain neurotransmitters involved in synaptic activity. This could lead to the person developing anxiety. Now, can a person be prescribed with regular anxiety pills, or would they have to be specialized for those that suffer from PMD or PMS?
Yeah, so some doctors do give people with SSRIs for PMD, but recent research has found that it's not very effective because the cause for these mood swings is not because serotonin is low. It's because of the changes of hormones that results in serotonin being low. So we have something called HRT, which is hormone replacement therapy. It's still in the works, so we don't know if it's going to 100% work, but they're more likely to work as it specifically targets the changes in hormones and make sure that we have a balanced level of hormones. And also it's a lot more safer because we're not giving the person something they don't have already. We're giving them the things they need, and it won't be in excess because there's already a significant drop in these hormones, which will hopefully result in an increase in serotonin. So yeah.
Hmm, I see. So basically, the way that doctors approach this is basically holistically. They don't look
Mm-hmm.
towards, curing the symptoms, specifically like
Yeah.
anxiety, depression, or counts of suicidal ideation, or any
Mm-hmm.
other symptoms. They basically treat the issue themselves by the hormone
Yeah.
replacement therapy, and that is interesting. But does it come with any side effects?
Currently, there's not enough information whether or not there is side effects because giving hormone replacement therapy for PMD is very, very new. So we're not too sure. However, people that do prescribe like SSRIs to somebody with PMD instead of the hormone replacement therapy, it can extremely like not help at all because you're giving somebody serotonin when that's not the reason why they need it, and it won't help with their anxieties or their depressions because we still have a decrease in the hormones.
Mm, I see. That is very interesting. PMD and PMS seems like a very strange condition that can sometimes be overlooked as depression or anxiety or many other
Hmm. Yeah.
known diseases. So it is honestly very difficult for a doctor or a gynecologist specifically not to make a faulty diagnosis on the patient,
Yeah.
which it brings me to another question. Um, how can we necessarily discern the differences between the certain symptoms that are experienced in PMS, excuse me, or PMD, and those that are observed in other diseases as well?
Yeah, so the symptoms definitely overlap. Sometimes they even overlap with neurological disorders, such as like migraines and epilepsy and multiple sclerosis, because they have headaches and like sensory sensitivities and mood changes. So, like, sometimes it's hard to tell whether it's PMS or if it's a neurological disorder or depression or anxiety. But the way to like determine, as I've said before, is the diaries. The diaries are very, very useful because we can tell that, okay, so this person, this patient, let's say like a 16-year-old girl, she's never had these issues before. There's nothing negative going on in her life, but for some reason, every month she's complaining of severe mood changes and she's not going outside like the week before her period and she doesn't want to socialize. So if we see a pattern like this, then it's most likely going to be PMS or PMD. It's difficult to take like a blood test and see if it's just the hormones because hormones fluctuate all the time. There might be other reasons. So the diaries are the number one way in determining if this is PMS, PMD, or something more severe.
All right. So another question would be, can talk therapy help with PMS or PMD, or is it all based on just medication? This can't be observed through the psychological or psychiatric lens.
No, so you can, there have been people that are specialized, some counselors are specialized in PMS and PMD. So it can help. Of course, it's not going to drastically change much because at the end of the day, the hormones are imbalanced. But speaking is always a great way to get your mind off these negative moods, reminding you that, okay, it's only for a week. I'm gonna feel like this. This is not reality. This is just me thinking like this for now, and it's going to get better. And like feeling hopeless and down is a really common symptom of PMD and PMS. So having someone to talk to and guide you through, especially when they're very specialized in PMD and PMS, will help you trigger like this idea in your mind that it's going to get better. And within a week's time, you're probably going to forget why you were even annoyed in the first place. So yeah, it's definitely a useful tool that can be vitalized and should be given to people alongside hormone replacement therapy.
All right, I see. And what if PMS or PMD worsens? What if it is still observed after the menstrual cycle, or what if it's still observed after a week? What do gynecologists do in that
Mm-hmm.
moment?
If someone has PMS or PMD after the menstrual period, it might not be PMS or PMD because this is supposed to be the week before the period. If it worsens after, then maybe if it's still to do with the hormones, they might have another disorder. They might have endometriosis, so their periods aren't even regular to begin with. There's so many other gynecological conditions that would mean that their hormones are not like working properly. Um, so yeah, it definitely needs to be looked into, but it wouldn't be PMS or PMD on its own that would cause these effects afterwards. Or maybe they just have depression and it's been misdiagnosed.
I see. Are there cases of misdiagnosis with PMS or
Yes,
PMD? Mm,
yes, there
I
can
can
be.
tell.
Yeah. And there's either people being diagnosed with depression and anxiety and they actually have PMD, or somebody that has
Mhm.
something much more severe that's unrelated to PMS and PMD, but they just can't be bothered. So they just say, no, it's just PMS. Every girl has this, and they just move on. So, yeah.
Mm, I see. Can PMS or PMD worsen with age, or does it only happen in teenagers?
It doesn't worsen with age, but it would be during the period time. So, like from teenagers up until they get their menopause. After the menopause, it should subside because there's no period, so these symptoms won't exist anymore. However, these symptoms are really similar to people with menopause, again, because the hormones go up and down, they've depleted, and so having hot flashes, depression, etc. is going to be symptoms of menopause, which is kind of similar to the symptoms you experienced before your period.
You've talked a lot about how there are many hormones. Can
Hmm.
you specify what are those hormones?
Yeah, so estrogen and progesterone are the main two hormones that go up and down and fluctuate. Whether it's higher or lower than usual doesn't really matter because that's the thing that affects the levels of dopamine, serotonin. So when the hormones of estrogen and progesterone go up and down, no matter how it goes, your body is trying to adapt and it's getting confused like what's going on, and it looking after your mental health is not its number one priority. It's trying to keep you alive. So if
Mhm.
these hormones fluctuate up or down, doesn't matter, it
Mhm.
will definitely not be focusing on your emotional well-being at this point.
Mhm. I see. Now, um, another question that I would ask is how can relatives or loved ones or maybe a concerned parent that doesn't know much about PMS or PMD
Mm-hmm.
necessarily do when their child is experiencing it? How can they
Yeah,
approach it the best way possible?
yeah. So I feel like a lot of moms, especially, they see their like annoyed teenage daughter and just say, oh, they're just teenagers, oh, they're just moody. And they go around bossing them around to do stuff or have more energy or telling them to smile and whatever. But you can't really do that, especially for somebody that's new to having PMS or new to having PMD because they've not had a menstrual period before. So they need time to know how to deal with themselves, and having this extra pressure from their parents is not good. So the way that they can help is giving them space, but making sure they're not trapped up in their rooms on their phones because they can go into a depressive cycle, which
Mm-hmm.
worsens and worsens with time because you don't have the support. Asking them what they like doing. If they want to go out, encourage them to go on a walk with you. Encourage them to join the family and watch a movie. But if they're being moody and upset, don't get angry. Just understand they're feeling like that because it's really not their fault. It's completely the hormones' fault. So as long as there's a mutual understanding and really good communication, their child will feel supported and happy.
Yeah, I feel like it's something that I guess needs to be addressed, within
Mhm.
parents, with the
Yeah.
girls especially, because it seems that there isn't really that much compassion when it comes down to a child undergoing periods or the
Mhm.
menstrual cycle in general,
Yeah.
especially children, especially preteens, because
Mhm.
at that age, most children, at least at that age, receive the periods for the first time, so they're probably scared, confused, and
Yeah.
frustrated. So I think it is very important for the parents to be understanding, to be empathetic, to
Mhm.
not really judge it or like just blame it on the fact that it's
Mhm.
puberty or teenagers
Yeah.
with their hormones and stuff. They
Yeah.
should definitely gain some sort of, I guess, some sort of awareness on how severe it can
Yeah.
be and how frustrating it can be for the child. So you have made a very valid point, a very interesting point as well,
Yeah.
that parents do need to be aware
Yeah.
that PMS and PMD is very much real. And I think it is an issue that some people don't even recognize PMS and PMD
Mhm.
because it's not only very new, it's also not really researched about enough. So some people can
Yeah.
actually dismiss it and say that, oh, PMS and PMD, it's just a new disorder that doctors have come up with, that
Yeah.
gynecologists have come up with because they couldn't really, you know, maybe quote unquote analyze the menstrual cycle properly enough
Mhm.
to conclude that it may be something else. So I think you have made
Yeah.
a good claim about that. Yeah.
And it's not really spoken about in schools because they usually just talk about puberty and just move on, but they don't mention that PMS is very common. Like most of your classroom is going to have girls with PMS at some point. And so they
Hmm.
don't know why they're annoyed. Their parents can't be bothered. And especially like in the Arab world, I feel their parents just say, oh, it's not got to do with us. Only Western kids get this. I don't know if you know what I
Yeah.
mean.
I hate
Yeah.
that narrative so much. I really hate it. Also, I believe Fiza has raised her hand. Fiza, is there anything you would like to add?
Oh, hi, Noor, hi, Sarah. I'm sorry. I'm Fiza, by the way. So I wanted to add that we have 6 minutes left. Do you want to carry on the podcast? Then, if you guys want to carry on, if you have more information to add, we can create another meeting and I can send you that so you can continue there.
You've spoken about how um it is an issue with the Western media. It's like, especially since Arabs usually have this notion that many diseases come from the phone and the child's
Yeah.
consumption of Western media. It's actually really frustrating, honestly. So I really
Yeah.
do hope that, especially parents that are very conservative, and it's not just Arab parents, it could be parents from all around the world,
Yeah.
parents in general. I just hope that they, try to be a bit more understanding of what their child is going through and not really blame everything on the phone, because it's honestly
Yeah.
very tiresome to hear this being repeated again and again. Yeah.
Yeah. And it's really odd because I'm pretty sure even mothers before their period are in a mood, but they can just be angry because they're a mom and they just get frustrated at things and it's fine. But why can't your daughter also have the same feelings? You're both going through the same thing.
Exactly. Yeah, that does make a lot of sense. And also, um, I think it's very important that also mothers may go through this. Of course, maybe not mothers that are undergoing menopause, but also mothers, maybe new mothers, they could also be
Mm-hmm.
experiencing that as well. And we might be, concluding that it might be just perhaps postpartum depression or
Yeah.
postpartum symptoms. So it doesn't only apply to children, but it also applies to women in general. And I think
Yeah.
it's very important that we do not just conclude them on, oh, it's just puberty, or oh, it's just postpartum depression.
Yeah.
So I'm really glad we had this talk. I've gained a lot of new information, and I've definitely established an awareness about the menstrual cycle. I think it's very important that we get informed about this and not really perceive subjects regarding the menstrual cycle as taboo, because the more
Mm-hmm.
information is read about, the more people can properly approach or address the issue within children,
Yeah.
especially because they might be not able to understand it completely. So I would like to thank you for attending this podcast.
Thank you so much for having me. It was great.
Thank you
Thank
so
you.
much. That's the
Likewise
end
to you.
of our podcast, and it was amazing.